Sirtex microspheres are delivered via a transfemoral catheter. The procedure should be performed by a qualified and Sirtex-trained interventional radiologist. The implant procedure takes place in the angiography suite to accommodate the placement of the catheter under X-ray guidance. Selective catheterization of the proper hepatic or lobar branches should only be attempted with a large lumen microcatheter. Fine bore catheters may block unless the microspheres are delivered as a very dilute suspension. Once the catheter has been correctly sited, the end of the catheter is connected to the delivery set that has been primed with water for injection. Sirtex microspheres are then delivered into the transfemoral catheter. It is essential that microspheres are not delivered to other organs, in particular the pancreas, stomach, or duodenum. The catheter must be placed well distal to the gastroduodenal artery in order to prevent microspheres traveling to the duodenum or stomach. It is advisable to embolize the gastroduodenal artery as well as the right gastric artery as a precaution. If there is any possibility of microspheres passing to the gastrointestinal tract, then the implant must not proceed. During the implant procedure, the radiologist should periodically check the position of the catheter to ensure it remains correctly sited during the delivery procedure. Place the delivery box on a drape and position the cart beside and slightly higher than the fluoroscopy table. Remove the cap on line A and connect the line to the transfemoral catheter. It is preferable not to use another three-way stopcock, as Sirtex microspheres may become trapped. Check the control knob is in the 12 o'clock position, and inject 2 to 3 milliliters of sterile water for injection from the B line to check that the microcatheter and A line are securely connected. A hand contrast run can be performed prior to the microsphere administration to double-check the catheter position. Be sure to flush the B line with enough water for injection to wash out the contrast. Mixing of contrast and Sirtex microspheres will cause clumping of the spheres and catheter occlusion. Turn the black stopcock control knob to the 3 o'clock position, which is the on position to the microspheres. Now, inject water for injection from the 20 milliliter syringe connected to the D line in pulses of 0.25 to 0.5 milliliters, separated by a pause. This will cause the Sirtex microspheres to swirl into suspension, passing through the C needle via the C line into the A line, which is connected to the catheter. It is important to inject slowly at a rate of not more than 5 milliliters per minute. Once about 2 to 3 centimeters of the A line are preloaded with microspheres, stop injecting water into the D line. Turn the stopcock control knob into the 12 o'clock position onto flush contrast. Pulse 3 to 5 milliliters water for injection from the syringe connected to the B line to flush the microcatheter and to gently push the microspheres in. The slow pulsed administration rate of no more than 5 milliliters per minute helps optimize the distribution of microspheres and reduces the possibility of Sirtex microspheres refluxing back down the hepatic artery and into other organs such as the stomach, duodenum, or the pancreas. Contrast is then injected through the microcatheter via the B line to evaluate antegrade flow within the artery. The contrast is cleared with water for injection. The microsphere delivery process is now repeated until the entire dose is delivered, or slowed antegrade flow is identified. The implantation should be performed slowly, taking about 20 minutes, and using multiple small aliquots of microspheres, followed by a water flush and a contrast run to continuously evaluate flow to the tumor. As the procedure proceeds and the microspheres become progressively less concentrated in the V-vial, the A line can be progressively loaded with longer aliquots of microspheres. When the dose in the V-vial is well diluted and appears almost clear, The last remaining amount of microspheres can be delivered by injecting air into the V-vial. Remove the delivery box lid and use forceps to raise the D-line needle up by a few millimeters. Using forceps again, carefully push the C-line needle to the V in the bottom of the V-vial. Replace the lid. Connect a 20 milliliter syringe filled with air to the D-line. Turn the stopcock control knob until it is in the on to the microspheres position, and gently infuse the air into the V-vial. Watch the air bubbles in the V-vial. The air will force the residual suspension out through the C needle sitting on the bottom of the V-vial. Turn the stopcock control knob off to microspheres before air starts entering the A-line to the patient. With the stopcock control knob in the flush contrast position, flush the A-line with water for injection. This will clear the catheter of any remaining microspheres prior to removal. Disconnect the 20 milliliter syringe from the B and D lines. Reattach the connector caps to both lines and push them back into the box. Pull the stopcock control knob back to remove the three-way stopcock from the holder. Remove the catheter slowly from the patient without disconnecting it from the A-line, and cover the tip with a gauze swab or something similar. Coil the catheter and place it in the benchtop waste container, followed by the V-vial and delivery set assembly.